Time and time again, research has proven that the most important factor of success when it comes to therapy is the therapeutic relationship. So basically, is whether or not a person likes their therapist, which is why this therapy in Wednesday is so especially bad because any therapist knows this research. They know how important the relationship is, yet this person makes some really, really bad elementary mistakes when it comes to therapy. That does not set the scene well for Wednesday to actually like and feel comfortable with this therapist. So, hi everybody, my name is Sabrina. For those who don't know me, I'm a clinical psychologist, and on this channel I talk about psychology as we see it in popular Netflix series and films. Today I'll be talking about the therapy session that we see in Wednesday, and the show is set to release its newest season on August 6th. I won't be talking about the family session that occurs in the first season of Wednesday, but if people are interested in seeing that, leave a comment down below, and if enough of you comment that you're interested, then I'll think about doing one. Enough yapping, let's jump right in. I wanted to start from right before the therapy session actually happens because it is so important to set the therapy up well so that whatever happens before the therapy doesn't actually bleed into the session and cause problems, which is exactly what we see happen here. And especially because Wednesday does not want to go to this therapy session, she's being forced to, and especially because she is a teenager, so a minor, that is being forced to go to this session, makes it really important to set it up for success.
Dr. Kinbott's office is on the second floor. Other Nevermore students swear by her.
And you'll be waiting here until I'm done?
Perhaps afterwards we can visit the weather vane for hot chocolate.
Principal Weems, this feeble attempt at bonding is beneath you. And chauffeuring your students around is clearly below your pay grade.
Given your history, I'm sure you're intent on running away. I'm here to prevent that from happening.
I wish you luck.
Now, I don't know if you caught the first problematic thing that the principal does. It's very small, but can create a huge problem. And that was her comment of all the Nevermore students swear by this therapist. Now, the main reason that this is such a big issue is because this comment is probably not actually going to make Wednesday feel more comfortable opening up in the session. Think about it. She mentioned all the Nevermore students swear by her, right? This implies that a lot of people, or at least a good bit of people from the school, go to this therapist, which means there's a pretty tight connection between the therapist and the school. She gets a lot of referrals from them. And so what that could indicate is that maybe she might be more inclined to be on the side of the school, because if she does kind of go against them in a way, she might not be getting as many referrals. So that's already an issue in and of itself, right? That maybe Wednesday already feels like, okay, this person is going to be an extension of the school, basically, that she's just going to already agree with everything the school is saying and not be on my side from the beginning. And also when we think about it too, her even saying all the Nevermore students swear by her. How would she know that unless the students actually told her, right? Like, she wouldn't be able to actually have an idea that they love this therapist unless either they said to the therapist directly and the therapist told the principal, which that's its own problem, or they told the principal directly. Like, maybe she forced them to report back on how their experience was, right? So even this, although it's very slight, could also make Wednesday feel like she might not have that much privacy. Like, she would either have to report back on how things are going, or Dr. Kinbott would do it for her, that she'd kind of report about her progress and things like that. So right away, with this comment that Wednesday makes, she's basically reading right through this fake warmth that the principal is putting on, right? This fake pretending to like her kind of thing, or wanting to get to know her, or caring a lot about her. And then Wednesday's intuition about this being really fake is confirmed, because right after she makes this comment of, hey, maybe after we can, get some ice cream and hang out, she then says, hey, don't try to escape. I know this is what you're going to do, right? So she then goes back into being this disciplinarian. And so this just reinforces the fact that she wasn't being genuine before. She was faking this warmth to try to kind of get something from Wednesday, which in this sense is basically trying to get compliance from her. And I wonder how that might play out when then she gets into the therapy session and the therapist herself is putting on this warmth. Like, probably right away, Wednesday might not feel that it's genuine. She might feel that she's doing it for some kind of reason to get something out of her. And even to further confirm this fake warmth that's not genuine, the comment that Wednesday made about this being below her pay grade is accurate. Like, as a principal, you aren't, I don't even think you're actually supposed to be driving students around, right? But even if she is allowed to, definitely below her pay grade and her role as a principal. So what this is showing is that Wednesday is so much of a problem that, look, even the principal of the school is going to drive her to the therapy session. And then we see why. At the end, she says, hey, I'm going to make sure that you don't escape. So putting herself in the position of the authority. And try to put yourself in Wednesday's shoes. Like, imagine, rewind back to high school, which can be a scary thing that I'm asking you to do, but try to imagine being back in high school and say you did something that wasn't great and now the school's forcing you to get therapy. Imagine the principal being in the car with the principal as they drive you to your therapy session. You probably would feel like, wow, this is such an issue or I'm such a problem that the principal is driving me to this session, right? That's not going to be a neutral experience. We are going to feel a way about that. So right away, the principal is setting up that Wednesday, you are a problem and you are here because we need to fix the problem, which is you and your behaviors. And to go back to the comment about, escaping and the principal saying, I know at some point you're going to want to escape and we're here to make that not happen. This is a huge issue for three big reasons. So the first is she's reinforcing the fact, or she's saying, at some point, you are going to run away. So even if Wednesday, say, wasn't going to or didn't plan to, this is basically communicating to her, at some point, you're going to get so uncomfortable or you're going to hate this experience that you're going to want to leave. So that's a problem in and of itself right there. Then the second, this comment creates almost like a game for Wednesday. What we know about her, even just the viewers, is that she loves intellectually besting people. Like, she loves being, the smartest in the room. And so she sets up this game of, I know you're going to want to leave, but you're not going to be able to because we're going to stop you. So her natural inclination is to say, no, I'm smarter than you, and so I'm going to be able to escape despite your hardest attempts. So game on, which is evident in her saying, I wish you luck, right? So I can guarantee at this point that there is a 100% chance that Wednesday is going to try to escape this therapy session. And then the third big issue with her saying this is it really creates or at least reinforces the idea that might already be created in Wednesday's mind that they are adversaries, that it is the principal and the school versus Wednesday, right? That she's basically saying, hey, you're going to try to do this and we're going to stop you. Like, you're going to have this goal and want to do this thing, but we are against you and opposed to this, so we are going to stop that from happening. And again, like I said, because she's recommending this therapist and because so many students go to her, then in Wednesday's mind, that can make it to where this therapist is on the school side. So if the principal is her adversary and the school is her adversary, then the therapist is going to be as well. So we see there are just so many issues with how this is set up that even if, like, Wednesday had just taken an Uber here, she would have had a much better, I think, chance of starting out on a better foot. So let's dig into the meat of this, which is the therapy.
I read the notes from your school counselor.
Oh my gosh. Out of all the ways to start a therapy session, this has got to be the absolute worst way I could think of for so many reasons. One, if you say, hey, I read the notes from your previous counselor, like, that counselor had their own opinion formed of Wednesday, and so now this person is coming in biased, which as therapists is the exact opposite of what we're supposed to be, right? So naturally in therapy, a person might often wonder, what's my therapist's thinking about me? Like, are they judging me? And especially because that prior therapy didn't work out, which is why she's at this new therapist, then likely Wednesday can kind of assume that some of the things that she read were more negative. And so, right off the bat, thinking this person has this negative perception about me. So, I definitely would not have done this at this point in the session. But I want to say that this isn't always necessarily a horrible thing to do. So, for instance, in the setting where I work in a drug and alcohol rehab center within the federal government. And so I have a lot of folks that come to me and they have already met with, their psychiatrist, maybe physician assistant, maybe they had a therapist in past, they're meeting with nursing, they're meeting with their kind of primary care. There's a whole lot of people on their team, and within the system that I'm a part of, majority of the people have sought services in other areas through this system before, and so a lot of the questions are exactly the same. And so for myself, what I'll do is look back at some of those old notes to fill in some of that like basic information. Even doing that, I can remember one client that I had where when we were basically done at the end of the intake, he mentioned, a lot of these questions were repetitive, and he really didn't like that aspect. And I've had people say that they, ask if I can see the other notes and chart, that they really don't want to have to repeat themselves with somebody else, which is not an uncommon thing to hear with people who've been in therapy for some time and maybe have had to switch to people. So, how I might set that up, which would be different than what happened in this case, is first I'm going to, explain to them why they're here, what this is going to entail. I'm going to talk about confidentiality and how I'm keeping their information private. I might ask them, like, hey, how have you been adjusting to the program so far? Do you have questions? Here's how often we're going to be meeting. Do some kind of setup, and then let them know I look through some of the notes in chart. That way I can fill out some of these kind of repetitive questions that you would have answered before. And then I also let them know, because since in our system we can see a lot of these notes, it can already feel somewhat invasive, like you have less privacy. So I'll also let people know, for other appointments that are completely unrelated, so things like dental, for instance, that I'm not just going to be perusing through your notes and chart to get this information. So often when I mention that, I can visibly see like the person is kind of comforted, or they either don't really care. They don't have a strong reaction to that, or they simply just say, okay. Or some people have even said, oh, great, I'm glad that you were able to look up and get some of this information. That way we don't have to go through all of this process. So I want to say that this isn't necessarily always the worst thing to do in certain settings that you might be in, but in this outpatient therapy setting that this therapist is in, definitely would not have done that at all. Probably wouldn't have looked through some of those notes for the first session just to be able to form my own opinions about Wednesday and hear from her more and just be able to build more of that rapport.
Mrs. Bronstein, she had a nervous breakdown after our last session. Had to take a 6-month sabbatical. Go ahead and take a seat. How did you feel about that? Vindicated. But someone who crochets for a hobby isn't a worthy adversary.
So here I want to give the therapist some kudos. There's not a lot of kudos I'll be giving her in this video, but I want to give her some kudos here because she doesn't get pulled in or sucked in to that comment that Wednesday made. It can be easy hearing something like that to kind of react, right? Like it's somewhat obvious that Wednesday took pride in this counselor going on a sabbatical because of her. So she's basically directly saying, this new person couldn't handle me. You probably won't be able to either. But she completely sidesteps that question and turns it back on Wednesday. And what she asks Wednesday actually really helps her get some good information. So she did really good here sidestepping this question. And I know there's been a couple videos in past with Wednesday asking, is she a psychopath? Is she a narcissist? Is she blah, blah, blah? You can tell that she enjoys challenging people and seeing their reactions. And so she wanted that kind of reaction here. She puts out a challenge, but she didn't get it. So the therapist did a really good job here.
Adversary, I hope we can forge a relationship based on trust and mutual respect. This is a safe space, Wednesday. A sanctuary where we can discuss anything. What you're thinking, feeling, your views on the world, personal philosophy.
Okay. Another thing that I think the therapist actually does somewhat decently here is that she's really trying to explain the therapy and what it's going to entail. This is so, so, so important to do, even if people have been in therapy before. We don't actually know what kind of therapy people might have been receiving before they come in, so it's still important to discuss it. And especially for people who have never been in therapy before, all the more so important because they likely have an incorrect view of what therapy will be like. A lot of that is because of media portrayals of therapies that are almost always, I'll say 90% of the time, incorrect. And so people might think this is what it really looks like when it doesn't. And up until really a few years ago, it was still somewhat taboo to be in therapy, and maybe not as many people were going. So it's really hard to know actually true therapy, what it entails, unless you go yourself. And since not a lot of people were going up until some time ago, we're talking about what that experience was, it's hard to correctly know how to portray it. Like, think about this going to a doctor's office and that initial check in where they're asking you all these questions, maybe taking your weight on the scales, whatever. That scene in a film, they can do pretty accurately because vast majority of people have done that before and have done that majority of times, but not a lot of people in terms of having a realistic therapy session. So it can often be hard to show what this looks like. So that's one of the reasons why it's so important to explain to people actually what happens, because if they have incorrect expectations from the start, then those are going to carry through the sessions and they might be dissatisfied or not able to engage as much because they feel like they're not getting something that realistically therapy shouldn't even give them in the first place. So she does do a good job with that, but maybe should have started with that instead of starting by saying, hey, I read up the notes on you.
I think that this is a waste of time. I see the world as a place that must be endured, and my personal philosophy is kill or be killed.
So, for instance, when someone bullies your brother, your response is to dump piranha in the pool.
You know the old saying, never bring a knife to a sword fight, unless it's concealed.
Now, I don't hate the question because it is important to know your viewpoint, any of your clients coming in, kind of how you see the world, how you operate in the world, and how that viewpoint of how you operate in the world could then impact your behavior. Because our thoughts do lead to some kind of behavior. So if I'm thinking something, even if it's inaccurate, it's going to impact the way that I act, right? So if somebody thinks that they're really stupid, even if that might not be accurate, that's going to impact the way that they act. So maybe they might not study as much for certain tests, or they might not raise their hand to speak up in class if they feel like, well, I'm stupid, so I'm going to get it wrong anyway. I'm going to fail this test anyway, even if that might not be accurate. And so it's important to know a client's worldview because that is going to be guiding a lot of the things that they might say or do. And the therapist's response shows that she was actually listening and truly trying to get at those deeper roots of Wednesday's behaviors and how it connects to these kind of core, these central beliefs that she has about herself and the world. But what I would have preferred, and likely what I would have done, is asked Wednesday herself to give an example, a real life example of this philosophy and how it played out in her life instead of me offering one. Right? So the therapist, she hears what Wednesday says and says, "Oh, so that's what happened in this situation when you put the piranhas in the pool." I would have much rather have Wednesday be the one to bring out that information. Because when we figure out something for ourselves, when we come to insight, that is much more powerful and much more memorable than when somebody just tells us something, just gives us some kind of information. And research backs this up, which is why I myself and us therapists will try to bring people to that insight rather than just offering something, even if the answer is pretty obvious to us. And so, in this sense, this could have been an opportunity for the therapist to bring Wednesday to insight and saying, okay, when are examples that this might play out in your life? Having her really think about it and see how this philosophy is affecting her life, maybe the sheer number of examples that she'd bring up, right? Versus the therapist herself saying, this is what's happening. And again, she wouldn't have been able to get this information unless she had read Wednesday's notes. So again, even her bringing up this example is another reminder to Wednesday, hey, remember I read up on you before, so I know these things about you.
The point is, you assaulted a boy and showed no remorse for your actions. That's why you're here.
He lost a testicle. I did the world a favor. People like Dalton shouldn't be allowed to procreate.
And ding, 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 here's the judgment. Remember how I said her tone was judgy before? Well, that statement, I mean, how judgmental can you be? And she has this strong assumption there in this statement, too. Says that you did this action and you didn't show any remorse for it, so you don't feel any remorse. Which, from Wednesday's actions, like that probably is pretty true. But even if you feel like you know that, it's still important to be curious about these behaviors, because when it comes to another person's thoughts or actions, their inner world, and why they do things, we will never know the reason until that person tells us. Anything else will always be an assumption. And when it comes to assumptions, we can be right about them, but we can also be very, very wrong. And so imagine with this instance and this reaction from her therapist, why in the world would Wednesday feel comfortable telling her other things that might have happened or other things that she might have done? Because she probably is going to expect to receive this strong judgment for it. And going back to the principal and when they were being in the car, we see the exact kind of fake warmth play out here. Up until that point, the therapist was seeming pretty warm and understanding, and then the tone shifted here, and that was completely dashed. So same thing like what happened in the car with the principal. There was that initial warmth, and then it was, dashed, and she's like, okay, let's actually get to the point. Let's stop putting on this fake warmth act. Which, the further they might go in their therapy sessions, whenever she is being warm, then it might be hard for Wednesday to believe that's genuine and there's no ulterior motive. But I do want to say, like, it can be incredibly taxing to have sessions with people who present in the same way that Wednesday does. I mean, we were just saying a few minute clip, and I'm already exhausted for this therapist. And imagine a full 50-minute session over multiple weeks. Like, that is just so incredibly taxing. So I do want to say that I do feel the therapist, pain. It can be tough to have this person that is really trying to challenge you and not trusting of you every moment, and it can feel like nothing you do is the right thing to do.
I've answered all your questions.
We're not done yet.
So I've had people try to get up and leave my therapy session before, or actually get up and leave, and I'm sure every single therapist that is watching this, or every single therapist in general, has as well. And this is never my response. What this does in this situation is, again, reinforce I'm the authority here, and because you are a minor and you're being told to come here, you have to listen and do what I say. Like, it's not the end of the world if a person is wanting to leave your therapy session. That's something that you can always process through and talk more about. So her urgency to say, we're not done yet, it's not that big a deal in the sense that her urgency around her sitting down, I think, was out of proportion to the action that's super common in therapy.
Therapy is a valuable tool to help you understand yourself. It can teach you new ways to deal with your emotions. It can also help you build a life that you want.
I know the life that I want.
Tell me about it.
These questions that she asked Wednesday, I think they're actually really great questions here, but the timing is really poor. I mean, Wednesday literally just wanted to get up and get the heck out of there. And the questions that she's asking her requires a high level of vulnerability. So being honest about the type of life that you want and what that looks like. But again, she just wanted to leave. Like, probably in that moment, she's not feeling very trusting or comfortable, and so it's unlikely that she's going to get out of her an actual response, which we see that she doesn't, or even if she does, like a response that is very deep and thorough and useful.
Everything said in these sessions is strictly confidential. Do your plans involve becoming an author? I understand you've written 3 novels about a teen girl detective, Viper de la Muerte. Can you tell me about her?
Viper is smart, perceptive, chronically misunderstood.
Any luck getting your work published?
Editors are short-sighted, fear-based life forms. One once described my writing as gratuitously morbid and suggested I seek psychiatric help. Ironic, isn't it?
How did you take that?
I sent her a thank you.
Now, I find this part so ironic to me, especially because she just mentioned confidentiality before this. But what a huge breach of Wednesday's privacy to have read her books before coming into this session. When we create these kinds of main characters in these stories, we'll typically use ourselves as a reference point. So often the main character in a story typically has pieces of us in there. So, like Viper, the main character in this story, it's obvious that she has aspects of Wednesday. So basically, the therapist is not just reading this story of random people, but it's Wednesday laid bare on these pages, and she didn't give her permission to do that, to see her in that state. So that can feel just incredibly uncomfortable. And then my thought here, too, as I was watching this, is that if they aren't published, how did the therapist get them? Like, how was she able to even read this? I mean, even if these stories were widely available on Amazon, that would still feel like a huge breach of privacy, the therapist going to buy it and read it. But if these aren't even available, like even a deeper breach of Wednesday's privacy because she would have had to seek them out in some way. So again, another hit, another reason for Wednesday to feel like, ooh, I do not feel comfortable here because you're getting information about me that I'm not giving you access to.
I've always been open to constructive criticism.
I'm glad to hear that. Because I was sent the manuscripts as part of your psych evaluation.
Oh, here we go. That's where she received it from. And again, look at Wednesday's face. Like she's still shocked and uncomfortable. And for it to be in a psych evaluation, that can kind of indicate too, like there is some deeply psychological issue with the things that you're writing and can make her feel like you are going to psychoanalyze everything I'm doing, which people already feel that way about therapists, especially psychologists. That's one of the first things, the classic cliches when I say I'm a psychologist that I always hear is, "Oh, are you psychoanalyzing me right now?" The answer is no. Please stop saying that to us. But it can really make her feel that way because the idea of, okay, I'm doing this in my free time, this hobby that I really enjoy, and now that's something that's going to be included in a psych eval, like I can't do anything right.
The relationship I found most intriguing was that of Viper and her mother, Dominica. Why don't we dig into that? Wednesday, part of this journey requires us going to uncomfortable places emotionally.
I don't travel well.
Okay, this is true that a big part of therapy is going to uncomfortable places emotionally. And I think it's good that she does mention this because a lot of people do feel like after therapy sessions, I should always feel better. But that's not really the case. Like, we're digging into tough things. So sometimes after a therapy session, you might feel a little bit worse because maybe you opened some wounds or maybe you kind of looked at aspects of yourself and your behavior that are tough to see in an effort to try to maybe change or work on those things to try to get to your goals. So it's not always going to feel cushy and nice. But the issue here is that she hasn't set this up as a safe space to go into uncomfortable things with Wednesday. And then her question here seems totally out of left field because she's not setting up why she actually wants to talk about this mother-daughter relationship. She just kind of asked this question for no reason. I mean, there is a reason, and the reason is she's read up on Wednesday before. And so there are things that she's seen in her history, and so she already has kind of in her mind a way that she wants to steer the conversation, which is another big kind of problem with reading up on folks is because maybe you do find things that are really interesting or really central to maybe the issues that people are having. And the whole time, you might just be waiting for a moment to sneak in that comment or to talk about this thing when it might not be the appropriate time yet. Like if she hadn't come in with this prior knowledge of Wednesday, they could have worked together and Wednesday could have been the one to kind of bring up some things that she was hoping to discuss and make it collaborative. That's a big part of the therapy, which I think a lot of people have a wrong view too, is that we're the therapists, so we're the ones who are always going to come in with the content, the topic, and the discussion, and that's just not the case. It is very collaborative. I don't know you. I don't know any of the clients that I have met before, and so you all are the expert of you, right? And so there might be some ideas that I have from us discussing and things that I feel like would be helpful, but it's so helpful and needed to hear from you.
Would you mind if I use the powder room first?
Ugh, her body language. At first, watching this, that gesture almost seems like a sassy, well, okay, yeah, just go to the bathroom, there it is. But then, when I really sit and think about it, coupled with the kind of deep sigh that she has when she's gesturing to the bathroom, she seems defeated to me, right? She seems like, ugh, I'm trying and nothing is working with this client. And being Wednesday, like, she's smart. She can probably perceive that as well. But if there really was kind of any part of her that was maybe wanting some help or wanting and hoping for some kind of change, having the person who is supposed to be there to try and help you in getting to that change feel defeated and not feel like they could do that after just a few minutes, how incredibly difficult that experience must be. It could really make you feel like a lost cause. That's one aspect of her body language, and then just throughout the whole session, she is just so uptight. Like, she's sitting just pin straight, and she's often, like, playing with her hands, like, she just seems incredibly anxious. So throughout the session, she's communicating this kind of discomfort to Wednesday. And as they're kind of ending the therapy session here, it seems that I kind of wanted to just go back to the thing about the notes and her reading the notes, that she just has such a clear agenda with all of her responses and all of the questions she's asking to Wednesday. She's just steering this conversation in a certain direction. And if she hadn't looked through her notes so meticulously, she wouldn't be. And part of the issue, among some of the other things that I mentioned before, is that reading the notes, it can make it harder to engage in perspective taking in the session. Like, the therapist actually does know a lot about Wednesday because she looked through it. So getting in the room with her, it could feel like that she almost expects that Wednesday might be comfortable with her already because she knows a lot about her. But Wednesday's never met this woman. She doesn't know anything about her. And so rightfully so, the Wednesday wouldn't necessarily feel comfortable or feel super open. It's almost like if you meet a celebrity, somebody that maybe you've been a fan of for a while, and you meet them and it feels like you know them, that person does not know you. So for them meeting you is pretty weird and a strange experience. And if you're kind of saying all these things about their life or whatever, it could be like, oh, okay, this is a little much. But you might feel that closeness to them because you know about their life. But again, they don't. So the therapist is kind of doing that. She's making that mistake here of having read up so much on her. She feels like she knows Wednesday and is so close to her, but Wednesday does not know her or feel that same way.
Is everything okay? You can't hide in there for the rest of the session.
I'm all right. Just preparing myself for our uncomfortable journey.
Again, she's just so anxious. Oh my gosh, you can just feel it. And this comment again reinforces to Wednesday, you don't have a lot of control in the situation. You don't have a lot of autonomy. You have to stay here and you have to go through this therapy session. When in real life, if a client wanted to hide in the bathroom for the rest of the session, I wouldn't recommend it, but they can do that. Like her saying, you can't hide in there all session. Like in real life, a client could do that if they wanted to. And instead of making this comment, if she was really worried about Wednesday going to the bathroom to try to avoid their conversation, then she could have and should have brought it up when she first asked to go to the powder room. Like in that moment, she could have been very direct and tried to ask her in some way if her going to the bathroom was related to her trying to avoid the conversation. And in general, throughout the therapy session, I do feel like this therapist misses a couple of opportunities to make these kind of process based comments about things that are happening in the moment. I don't think a lot of times people understand how the behaviors that you have outside could also show up and will also show up in therapy. Even when Wednesday initially mentions that she feels like life is something to be or the world is something to be endured, if she feels that way generally, then it's likely that she might also feel like therapy is something to be endured. You might just simply say, how do you think that that might show up here? How do you anticipate that that might show up here in therapy? You can use that question for literally, I mean, anything. And hearing me say that, if any of you are in therapy, you might have heard maybe your therapist say that to you. And that's to try to kind of get at and have you think of one, the fact that these things will show up in therapy, And two, if they do, what that would actually look like. That way, when that happens, it can also try to give you more insight in the moment of it happening. So she misses those opportunities for, again, things that could eventually bring in some insight for Wednesday. And with these videos, even though these are actors, actresses that I might be covering, as somebody that does therapy myself, I still have that kind of empathy for how difficult it can be. And the fact that we are human, we have off days, there's difficult clients where we feel like we didn't do our best with them. And so I don't necessarily want to be overly critical, kind of being that way to show you all somewhat of how maybe our mind works and things that would be different in actual therapy. So you don't think that some media portrayals are realistic to what the experience might be. But a big aspect of our role is this idea of self reflection. So, really taking time to think about, how did this therapy go? Are any of my biases showing up in this session? Doing a lot of that reflection ahead of time, getting things like supervision, peer supervision to help. Because as much as I try, I am just me. So, if I have any kind of biases, I might be blind to some of them. So being able to get other people that can help, that you can consult with and can give advice or ways to tackle a situation. Like when I was in grad school, for instance, we'd always have to record our own sessions and we'd watch them back. Maybe we'd select a portion to send to our supervisor, talk about it in supervision. We even had group supervision where we had to pick a snippet and then all the people in the grad school class would watch you doing therapy and kind of give some feedback, like talk about an anxiety provoking situation, but was so, so helpful. And so I don't believe that this therapist in Wednesday is a lost cause. I think if she did some reflecting, got some supervision, and got some help, and Wednesday being more of a difficult client, I think this would be a great person to get some supervision on, that she could turn this around.
Wednesday, you need help. More help than I can give you. I'm going to recommend you stay in a juvenile psychiatric facility for observation.
You and I both know I'd be running that place in a week.
Time's up, Laurel.